Welcome to the University of Washington School of Nursing Voices of Nursing podcast, where we dive deep into the diverse and inspiring stories from the heart of healthcare. This is Voices of Nursing. Welcome to the Voices of Nursing podcast. Today I'm joined by Dr. Oleg Zaslavsky, PhD at University of Washington School of Nursing. Welcome to the podcast, Oleg.
Excellent. Thank you. Thank you for this very generous invite.
We're so glad that you decided to make it. We want to begin with asking a little bit about you and your personal journey to where you are today. And in particular, we're going to explore some areas that I've been very pleased to get to know you more about, which is your work in gerontological health and digital health innovation. But first, let's focus a little bit on gerontological health. Like, why gerontological nursing? Why gerontological research? What brought you to this moment? Tell us a little bit about Oleg and your motivations.
Oh, fantastic. Thank you for the opportunity to talk more about and reflect on my journey. So this is a great question. So I came to UW as an international student in 2008 on a Fulbright scholarship, and right away took a deep dive into the world of gerontological nursing, coming back with the clinical expertise from the emergency nursing and seeing that very common problem in older adults that they come, that they receive acute care and then come back to the community and then would bounce back to the emergency department with the different type of problems. And when they come back, they would be much more deconditioned and have a worse function than they originally. And then that's self-perpetuating vicious cycle would happen again and again. So as emergency nurse, I would and working for a couple of years, like I would see this what we call frequent flyers. So they would come and we will provide the best care, send them to the either hospitalized or send them home, and then they would come back again with the worsening of their underlying either health condition or just overall worsening of health condition. And that I filed away that observation and thought that I would want to explore it more and understand why it's happening. So that's what led to my journey and applying to the PhD nursing in University of Washington. And when I came here, I was fortunate to engage with an outstanding group of mentors. And one of my long-term mentor and personal friend was Riba DeTorne. So the person that founded the DeTorne Center for Healthy Aging. And we had we connected right away around this interest in gerontological nursing, and I shared my observations and I shared my insight, and we had almost weekly meetings where I would come and we would chat about the issues that the older adults facing, and that was the time where Riba transitioned to retirement community. And what services could be provided to older adults facing the declining health, what's called age-related changes. So it's not well-defined chronic condition, but it's also people facing some changes such as slowing down, having less fatigue, having more fatigue, having less physical activity. So later I learned like what we discussed. It was a geriatric syndrome of frailty. So that was a time where we discussed and we floated different ideas. And and at that time also it was one of the things that when you see it, but it was hard to quantify it with the concrete tools. And in this conversation, kind of I solidified more my passion and interest in gerontological nursing and in that interest. And I learned about great resources from the University of Washington, such as DeTorne Center for Healthy Aging. And at that time, the director of DeTorne Center for Healthy Aging was Dr. Barbara Cochrane, who later became a chair of my supervisory group. And I was fortunate to engage some other members in helping me to move through my educational journey. I was fortunate to work with Nancy Woods, who was another dissertation, another person involved in my supervisory group. I also was fortunate to work with Andrea LaCroix, who at that time worked at the Fred Hutch, and I was fortunate also to work with the ONR, with Office of Nursing Research, and they had a statistician on board. Her name is Jerry Harold. So that was my supervisory group that helped me to navigate my work and helped me to move ahead with my idea of understanding what frailty is, what are the age-related changes, like to what extent we can develop strategies to screen older adults for frailty, and in case we know that we know that they are facing frailty, what we can do about that. So it's basically, at that time I pulled it together into three paper dissertation and graduated from the University of Washington School of Nursing in 2012, like after 4 years. Being here and focusing on this issue of gerontological nursing, I forgot to mention another outstanding mentor throughout this journey, and another member of my dissertation group was Dr. Hillary Thompson. So she was the one that welcomed me to UW, and she was my first academic advisor. So it's kind of closing the whole loop to come back to the same place where you were as the students, and now and calling them colleagues. So that was how my idea of passion to gerontological nursing came into being. And then after I finished my work, as I mentioned, being a Fulbright scholar, and as part of the expectation of this fellowship or scholarships, you go back to your home country and share back your experience. So I went back to Israel, which was my home country, and then I worked for several years as a faculty in one of the universities in North Israel, in Haifa. So that I worked for 3 years, and I stayed in touch with my mentors. I kept publishing, kept doing work in gerontological nursing with a focus on frailty, and working in the clinical epidemiology. And I also was stay in touch with a couple of great researchers in geriatrics. One of them is Dr. Eric Larson. He was the director of what it was called at that time Group Health Research Institute, and later it turned into the Kaiser Permanente Washington Health Research Institute. He was the director of that institute, and has a great clinical expertise in geriatric and gerontology. He was one of the leading national experts in dementia, and had a great cohort study that they launched in the late 90s to see and to quantify. I think that study was about cognitive health in older adults, and it has a very nice acronym, ACT, Adult Changes and Thoughts. So throughout my time being in Israel, I kept working with Dr. Eric Larson on a couple of important papers that would use that ACT data and to see how frailty, basically on the connection between frailty and cognitive health in older adults. So that was my time in Israel for 3 years, and then in 2015 I was fortunate to be hired back to UW, and when I came here, so I kept my epidemiological work with clinical epidemiology to understand what frailty is, what are the age-related changes. But at some point, once we have a good understanding, I wanted to do something about that. So it's not only about observing and understanding, but develop tool that would be accessible to many people that they can use to do something about these age-related changes. Mm-hmm. Because on one hand, it's a common, but fortunately, it's also preventable. And or again, it can be either preventable or can help people live better with that condition. So that's my evolution of my or migration of my work from the clinical epidemiology into the more intervention work, or more to develop tools that will allow people to do something about what they face, and living well despite of the health challenges that they face.
That makes perfect sense when you think about your history and the beginnings of your nursing journey. When you talk about, you saw those frequent flyers and you saw that cycle and tucked that information away and said, I want to do something about that. And you did the observation and you did the work and the research, and then came back around to that desire still being there of I want to do something about that. I want to intervene in the things that I'm seeing. When you were, and I know this is ongoing work, but how are you defining frailty? I'm just curious.
Oh, wow. That's a great question. And thank you for your insightful observations. Well, it was one of the things that when again, as experienced nurse, you would, when you saw that. So at some point when people were walking into the ER, or you see that, when you talk to the nurses, they would use that term. They would say or this person seems to be frail, or this person seems to be bad. But it took a while to operationalize, to quantify that observation. What do you actually mean by that? To untangle that more. And I had a great exercise where I was fortunate to teach in the undergrad program, and one of the exercises that we did, we had different images of all the adults, and then and again at that time I talked to them about my research, and so we had these images of different older adults, and I would ask them to point who they would think that is a frail, and they would, and there was a fairly consistent, they were able to differentiate or distinct, or to say that somebody might be more frail than somebody else. And then we had an exercise what do you observe? What do you see? How do you know that somebody is facing that geriatric syndrome of frailty? Because you don't in some other things, like with the diabetes or heart disease, you're not always know. But with the frailty, so there were some telltale signs on that. And with the time, and again, when you look in the gerontological and geriatric literature, there were more and more studies that were developing tools that would allow to screen for frailty. And there were different school of thoughts, what frailty is. Is it phenotype or so? I think that there were a couple of approaches that came from the different institute, but we used one of the ways to quantify frailty as a phenotype, meaning that some of the people that facing that condition would have a present, they would have a critical mass of the symptoms, and the symptoms were slowing down. Somebody that would not, and it was an interesting thing. I just anecdotally, somebody would tell, what does it slowing down mean? How do you know that you're slowing down? And one of the examples somebody brought up, I thought that was hilarious and interesting. When you're about to cross the crosswalk, and there is a countdown, how much do you need to have on that countdown before you decide to cross the street? When do you charge? And again, do you need the full count, or do you need the half count? Do you start charging when you see 5 seconds left? And you clearly see some younger folks, there's 5 seconds left to cross the ground. They will charge, or some folks would stand on the sideline and wait for longer. So that was kind of overall conceptualization or overall example of slowing down. So with each we see things taking longer, and there is just age-related slowing down, and the gate speed slowing down, in the processing speed, and just in general slowing down. The second one would be being more fatigued and having less energy, just an overall feeling that you need to preserve some your energy, so you don't have as much vigor as somebody used to have. And so the third one would be having less physical activity, being less physically active, and again, like some things that might be interrelated. The fourth would be having some age-related weight changes, having less muscle mass, muscle tone, and the last one having less muscle strength, like having like less grip strength. So an overall presence of 3 out of 5 of these signs would indicate that person is frail. Having 1 or 2 would indicate that person is pre-frail, so it's on the cusp of becoming frail, and not having like it's being non-frail at all. And frailty in general would be an early indicator of a person needing more help. So it's basically sometimes it might be a trigger for people to consider moving from the independent living to, or for example, assisted living, to wherever I understand. Like something going on with my health, and I might need more support. And also, we will learn that the frailty itself might be an early sign that like there might be more changes coming down the line. So people, there is a need to either preserving what you have or preventing this condition altogether. So that's what we learn. We develop a couple of tools that it will allow people to screen for frailty. We even develop one of the what is called self-report tools, so that people can use it by themselves and to feel it out and to know where they stand on that in the health journey. So we made sure to develop something that could be usable and accessible for all. You don't need to go to the clinician office. Sometimes you can use this, or the clinician themselves can use it for easy screening because of the busy practice and everything.
That makes sense.
Does it make sense?
Yes, okay. Yeah. Something that's intuitive and what's the word? Accessible. You said accessible. So this makes me think about the intervention side, and then also leads me into this world that you've found yourself in of digital health. And I know there's lots of preconceived notions about whether elders and folks who are experiencing aging, whether digital health tools are things that is realistic for them to be using. But I mean, I think that you would probably say something to the contrary, that actually they are using these. So tell me why digital health, and how has this been a mechanism for those interventions that you're talking about?
So another fantastic question. Thank you for asking this, very insightful, and for framing that there is a misconception about how much older adults what word accept technology, and how much I'm blanking on the word. It will come to be.
Do you mind if I give it?
Yeah, please do. Adopt technology, and how there's like another term, but in our work we learned that older adults might not embrace technology for the sake of innovation. So even though we see this with the digitally native, the millennials, so they would get excited about technology itself, right? So
then Gen Zs, then Gen Alpha,
all the exactly. So all the gens and we have interesting terms, the digital natives and digital immigrants. Right. So the digital natives, so they would embrace technology for the sake of innovation, because it's new gadget, new software, and then they would embrace it, and we will work with it. And then they will find is it useful for them, or they might abandon it altogether. For the older adults, they are less likely to embrace technology for the sake of innovation, but they're more likely to embrace technology because they find specific utility. They find specific use of it. So that was a point of our that was a guiding principles for our development to develop technology that it's not new and shiny. It's not it doesn't have like all the bells and whistles, but it will be something that will speak to their needs and will show, and there will be a direct link to how they will, why they would use it and how they will use it. So we would also spend quite a bit of time involving them in the design from the get-go to bring them on board, and we learn great, to the great extent from their perspective. But it's also showing them the exact how this technology can help them to get where they would want to be. So it has a more immediate feedback, more spending a bit more time on training and letting them understand to create it's very usable, easy to use, user friendly, to have this breadcrumbs spread throughout, so that they will for the easy troubleshoot. And once you have this all together, so you see that this population not only embrace technology, but sometimes or many times they would more likely to spend more time on technology than even some younger users. Mm-hmm. So that was a kind of interesting and sometimes counterintuitive. So and I'm speaking to the time that was pre-2020, pre-pandemic and prolonged installation, and their more use of technology. So at that time, pre-pandemic, we would spend more time explaining the value of technology and explaining why it's a tool that increase access to services and increase access to some of the tools that they can use in daily. These days, I feel that we need to explain this less somehow, because the people get more used to technology. But again, reflecting to the early days, we learned that all the adults would embrace technology because they find it useful for them, but not for the sake of innovation. So that's why we spent quite considerable time in working with them. So we would have a stakeholder, we will have like advisory group, we have a small group of people that we co-design, and then we would pilot test. We will engage in the very iterative process, and by the end of the day, once you develop something that work with them well, when you have a very explicit training materials, when you develop something that is easy for them to use, they would be one of the more loyal and more sustained users.
That makes perfect sense, because they had a hand in it, right? And you listened to them, and this participatory design process, is just inherently centering their needs. So it would make sense. You're not just, I love what you said, that it's not technology for the sake of innovation. It's about utility, right? And that's such a rational human thing. I'm not going to just go pick up a piece of, I mean, maybe I may be a little bit of a Luddite, but I'm not going to go pick up a new way of doing something just for the sake of figuring it out. But there are some folks who do, right? My husband's very much the early adopter on the diffusion of innovation curve. Like, he's the early adopter. He's like, I want to be the first one in line to get the new thing. But the vast majority of us are very rational in it, that we want to know, how's this going to help benefit my life? And that sounds like that's what you were able to help them see.
Absolutely. Speed dating with technology, it's not something that they would be enthusiastic about, but
speed dating at any age is not exactly fun. So
yeah. So that's what they would spend more time explaining, walking with them, and developing something that speaks to their needs, to their unique needs. And sometimes it would be interesting that off-the-shelf solutions, and again, that it will not be a best match, because from the with time it's getting better, but for a while they were not in the front end of developing. So we have a several intervention where we used common social media, and we saw that the interface of that common social media was very confusing for all the adults. So like they would get bombarded with it. So that's why we moved away and developed something that has much leaner interface, has a less busy linear interface, and that we saw that the huge uptake in the intervention. So even at the expense of some other exciting features. So sometimes you would trade this exciting feature with much much leaner design. So that's why off the shelf not always work, and then as you mentioned, participatory design and spending time on training and empowering them. So this was another very important thing for us to consider, the whole self-efficacy, because sometimes in the digital literacy, so you would need to face people where they are, to meet people where they are, in trying to understand like how much information you would want me to provide you, and again like being very, very explicit that they might have less understanding. And some of other projects, like we would have very naive users, so that would be the first time they use computer, or the first time less computer. So we would use a iPad or mobile phones, and sometimes they're understanding their need. So like saying, if you develop something for iOS, or no, it's even like for Android. So you would rather than use mobile smartphones, you would use tablets, and this would have them more room to find the features I have. Like it's my bit. So basically, working with your target population, understanding well their need, using some of the off the shelf options, but also understanding how much they need to be customized. Because just taking it and plugging it unfortunately it doesn't work.
What, doing things fast just for the sake of getting it done? That doesn't always work.
Right.
It turns out sometimes it's better to do things right than to do it fast, right?
Yeah.
Well, thank you so much for sharing about that experience, and it brings me to naturally the conversation about the Digital Health Innovation Hub, because you're talking about these particular, I don't want to say, distinct, because they're interconnected, right? These are all interconnected research efforts and intervention efforts, and in many ways interdisciplinary, right? Because I'm hearing you talk about human-centered design principles and nursing together. So this is very interwoven. It makes me wonder, what is the purpose of a digital innovation hub, right? And I know it's a little bit of a softball, but I'm going to open it up to you. Like, what's the utility there? What purpose does that serve?
Another great question. Thank you for asking. And as you said, like it's a softball, and I will be happy to talk more about this exciting initiative in our school, the Digital Health Innovation Hub, that I was fortunate to be appointed as the inaugural director, and we are launching this effort, and would want to spread the word and talk more about this initiative, and it's another evolution and another observation that I gathered over time, and like looking and learning more about digital innovation. And seeing that even though nursing is the largest healthcare workforce in the U.S., and many times nurses on the heart of the patient care, that they provide the direct patient care. But when it comes to the digital innovation, somehow nursing lagging behind. So some of the literature indicate that less than 0.5% of digital health innovation come from nurses, and I believe that we might need to do a better work in infusing digital competencies in nursing education, and helping nursing to understand the subtleties of working, again, and terminology, and working part of the interdisciplinary team. I think we are heading there, but we are not there. So we got the ball is rolling in the right direction, and we have more nurses engaged and more nurses amplified. But it's also some of the fundamental digital competencies, and something that we would want to work more on. So, and it's might be something from the get-go, from the undergrad to graduate students, because every cohort we do have quite a few students interested in the digital innovation, interested in the use of technology, and we would like to provide them with a better support. So that's one of the foundational principles of this Digital Health Innovation Hub, is to be a resource for nurses and other healthcare professions to learn more about digital health innovation, to learn more about tools that would allow them to help more people in using technology. So that's the kind of foundational principles of this digital health innovation hub to empower and equip nurses to work in the interdisciplinary team and to amplify their voice and to help them to engage more in the digital innovation. So that's and broadly speaking about digital health, I think we have a 3 pillars, domains, or whatever term we use, 3 directions. So one of them it's interfacing students, again, undergraduate, graduate student, to provide them with the resources and maybe even with the educational sessions on how to approach digital innovation. So second pillar that we would interface and to help faculty. We have outstanding a group of faculty that many of them they're doing great work in the digital innovation, and many people thinking about how to scale their work and how to get it into the hands of more people, but to understand how to move in that continuum from the ideation to dissemination. It's not linear. So that's why helping them to work throughout this continuum from the ideation to get it into the hand of end user. It's because we are well trained in understanding science. We're well trained in developing this technology using very rigorous principles and very rigorous science, but it does not end there. So sometimes it's a gap, like what it takes from validating technology and understanding the technology work and understanding who it works for, like who are the patients that benefit from technology, but then handing into the hands of clinicians, or even like into getting into the hands of end users. It takes sometimes it's a different skill set.
Right. It's a whole other skill set to deliver and then scale up.
Exactly.
And to know how do we work into this network. It's a complicated system. Procurement and socializing ideas and all of that stuff, that makes sense that it would need another toolbox.
Exactly. So, and this is what we think about digital health innovation can step in, how to help people that already sunk their teeth into the digital health innovation to move forward along this continuous and like working with the faculty at the school and basically some other people that it would be interested in learning more. And the last interfacing is working with the community and industry, because many times they have a very interesting, innovative idea, but we would want to, but they would want to have some due diligence and some pragmatic check and to work and to understand the merit of their idea. So, not. Sometimes when you develop the hammer, like everything looks like a nail. But we want yes. to be more specific, like how that hammer will fit within the, again, as you mentioned, very complicated healthcare system with the nurses in the forefront of the patient care and how that will benefit patients. Like especially when it involves nursing as far as either users or people that would advocate for that use. So and working with the industry and community partners to help them with either ideation or help them to develop technology or to be a living lab for these ideas. So if there are some interesting ideas that interface nursing, that interface our busy clinicians, so we would want to develop this as a resource for them. So again, to provide them very pragmatic, and nurses are very practical, very pragmatic. So they to tell them more about what are the merits of technology and what the opportunities for improvement. Again, so that's another set of services that we would want to provide. For example, even nowadays, some of the industry women, they have interesting ideas and they are pitching these ideas to National Institute of Health. Mm-hmm. There are specific funding opportunity for small business called SBIR or STTR. So they reach out to us to look over their application and to provide input.
So you would provide that kind of a service.
Yeah. That is correct. So then this is something that I've been working this morning, looking through the SBIR application of one of our industry that they develop a exciting cognitive screening tool, and they envision that it will be used by clinicians, including nurses, and like I would want, and they wanted to get some due diligence to say like how that the SBIR speaks to the needs, and that this is exactly right before this talk.
Oh, that's excellent. That's so excellent. Thank you so much for sharing, Oleg. It's been a pleasure having you on the podcast. What advice would you give to someone who is in nursing currently, the way that you were in nursing long ago in the emergency department, and they're considering, what are my options? What can I do next? Perhaps, there's a large number of nurses that are facing burnout, nurses that are, trying to figure out what they're going to do with their career if they're feeling like perhaps bedside or acute care maybe isn't hitting all the marks for them. Some of them are going in different directions, nurse practitioners, a variety are going into other kinds of care, telehealth, et cetera. But what about the folks who, like you said, you've got many, many students who are interested in cultivating this nexus between nursing and digital health? What would you say to those folks who are kind of at the beginning and wondering if this is for them?
Yeah, no, this is a great question. So the first of all, one of the recommendations, stay curious, and be curious and stay curious, because I think that there are so many things we are as nurses observe in clinical care and file them away or give a credit to somebody else that they will solve that. So I would strongly encourage them, be inquisitive, stay curious, and then when you understand that it's something that you would want to, again, like sink your teeth into, follow through. So I think that there is no better reward, more reward than caring forward something that you observe in a clinical practice, and then follow this through. That's as similar to what what I can reflect now is about my observation about this rotating door in ER, and then eventually understanding it better and being one of the experts in the field. So that's number one. So stay curious. Again, I'm not paraphrasing Steve Jobs. But there's something in that where you follow through your passion and your inquisitive spirit. That's number one. Number two, I think we should be entrepreneurial, and we need to develop that entrepreneurial spirit. So when you see opportunity, you should explore it. So don't be hesitant about walk into the open doors, and create these open doors for yourself. So I think that's number one. So you don't know what opportunities are unless you try. So it's sometimes it's easy to say that, or it does not work for me, or it will not fit me well unless you try, and then you can unleash your whole potential. So you many times you don't know what your whole potential is until you try, and again, the sky's this limit. And the third one, and this is what I tell many students, and again, that part of this academic journey, that sometimes they need to deal with the rejections, or to deal with their great ideas not receiving appropriate feedback. So again, I would be more liberal about paraphrasing Winston Churchill, saying success in academia is something along like the spirit moving from rejection to rejection without loss of enthusiasm. So it's basically some of the rejection might actually give you either better idea or have a better understanding on how to tighten your proposal, or and how to look and some other things that you did not. So it's basically determination and follow through. So it's when I teach, and I just finished teaching this large class about the writing proposal, and would reflect on our own history. So sometimes the students, some we many times we speak about our success, but we are less reflected about what it takes to get there. So and being practical and being pragmatic. So it's very nonlinear journey. So it takes multiple tries, and even it looks very linear. So it's the academic journey and the progress is takes many turns, but eventually you get there, and it's very rewarding.
Thank you so much for sharing everything that you did with us today. It was an absolute pleasure to have you on the podcast. I hope that in the coming years, as the Digital Health Innovation Hub takes off, that we'll have cause to speak again and have you as a guest once more.
I first of all, it was a true pleasure to be in the podcast, and it's the first podcast experience for me, and it has been very rewarding. But I also hope that you will consider inviting me again and to tell more about all the great things that we'll be doing, like with the Digital Health Innovation Hub. I do expect quite a busy couple of years, and
yes, it will be.
And I expect many, and I hope that this podcast will inspire people to explore our hub, and I'm more than happy to connect, and we will share my contact information.
If you were inspired or found yourself curious about anything you heard today, please reach out to Dr. Oleg Zaslavsky at ozasl@uw.edu, or check out the hub itself at digitalhealthhub.nursing.uw.edu. Thank you for tuning in to University of Washington School of Nursing's Voices of Nursing podcast. Join us next time as we continue to explore topics vital to nursing, health, and well-being. Until then, stay informed, stay inspired, and stay engaged. And don't forget, follow Voices of Nursing wherever you listen to your favorite podcasts, so you'll get every show as soon as it's released.